Good morning, everybody. My name is Dina Diorio, and I am the Mecklenburg County Manager. I'm joined today by Gibby Harris, who is the Mecklenburg County Public Health Director, Chief Robert Graham, who's the Director of Emergency Management for Mecklenburg County, John Studnick, who is the Deputy Director for Medic, Angela Charles, the Assistant City Manager, Ernest Winston, the Superintendent of Schools, Brent Cagle, the Aviation Director, Dr. Jim Hunter, who is the Chief Medical Officer for Atrium Health, Dr. Sid Fletcher, who's the Chief Clinical Officer for the Greater Charlotte Market for Novant Health. We're here today because we want to give you an update on COVID-19 here in Mecklenburg County. I'm going to turn first the podium over to Gibby Harris, who's going to give you an update on the situation on the ground. And then I'll turn it over to Chief Robert Graham, the Director of Emergency Management, to talk about the role of the Emergency Operations Center. And then we will open it up to questions to all the people who are standing with me here today. I did want to let you know there will not be any individual interviews after the press conference, so if you have questions, my recommendation is that you ask them at this time. So with that, I will turn it over to Gibby Harris, the Director of Public Health for Mecklenburg County.
Thank you, Manager Diorio. Good morning, everyone. I appreciate you coming in today and helping us get information out to the community so that people can be prepared. Last night, we learned that we have had 2 individuals who were tested at facilities in Mecklenburg County are presumptive positive for COVID-19. We are investigating at this point in time. We are not sure that both of them are residents of Mecklenburg County. So one might actually be residents of a surrounding county, but we do know that we at least have 1 case in Mecklenburg County at this time. These individuals are isolating at home. They will be issued isolation orders by the health department that outlines to them what the expectations are of them in maintaining that isolation. In addition to that, we are in the process of investigating both of these cases to fully understand the situation, understand who may have come in contact with these individuals and may be at risk. Once we've determined who those individuals are, we will be issuing quarantine orders, especially for those who are in the homes of these individuals, but also for others who may have been at significant risk of exposure. And they will be quarantined for 14 days at home as well. I want to reinforce for you the governor's messages around the things that we need to be paying attention to in our community. Specifically, those folks who are most at risk. And those involve our individuals who are 65 and older, those individuals who have chronic diseases, and those individuals who have compromised immune systems. The recommendations for those individuals is that they should avoid exposure as much as possible. One of the things we have done this morning is we have sent recommendations out to all of those facilities that provide housing services for those individuals over 65, that they restrict visitation to immediate family members who are not symptomatic. So that went out this morning, and we understand that some of those facilities are already starting to implement those restricted visitations. We are also recommending that anyone over 65 avoid any type of mass gathering, all the way to including church services. So we will continue to reinforce that message. These are the individuals who are most at risk for severe adverse reactions to COVID-19. There have been lots of questions about testing. So I'm going to try to clear some of that up a little bit. The messages vary from the federal level to the state level to the local level. We do have increased testing available in this community. It is still limited. So we are being very careful working with our partners who have the ability to test to make sure that we are testing those people that we need to at this point. We are not testing individuals who are asymptomatic unless they have very significant risk possibilities. So I want to reassure people that we are testing as much as we can, but we do want to make sure that those folks who are symptomatic and who could potentially be exposing other people are being tested. We have individuals showing up at doctor's offices, at the health department, at the hospitals asking to be tested. If they are not symptomatic, if they don't meet the criteria we're using right now, we will limit that testing at this point. I also want to remind everybody about mass gatherings. There's lots of questions about that. We have a number of events this weekend. There are discussions that are happening right now about that. We also understand that the governor will have a press conference later this afternoon providing more specific guidance to the state as a whole. So we will wait to hear from the governor, and then we'll issue whatever we need to for the county. But please know that there are conversations happening around mass gatherings. At this point in time, the governor does not recommend closure of schools. So we are not recommending closure of schools at this point in time. As you can see from the number of people here this morning, we are working with our partners. Everybody is engaged and involved, and we're trying to be as comprehensive as we can and making sure that our response is what it needs to be and that we are giving the right messages and the similar messages to our community so they can understand what the situation is here. I want to reinforce the fact that we do have a web page. The county web page is updated daily. We are reorganizing that page a little bit to make it a little more user-friendly because we've been putting lots of information on it and it's getting a little crowded. So please push your community members, individuals that you work with to that page. That information will be the most update they can access. In addition to that, we continue to have our information line that is available. That number is 980-314-9400. We need the community to understand that for most individuals calling, that number will not be 24/7. It will be an 8 to 5 number at this point in time. So they may leave a message and we'll get back to them as quickly as we can. I want to reinforce the fact that we are now in a situation where we could potentially have community spread. We understand that that was coming, and we want to reinforce that that is likely in our community. But at the same time, we want people to do what they can to help protect themselves and to protect the community at large. If you have any concerns for yourself or your family about attending mass gatherings, then don't go. You have the right to make that decision until we make recommendations about mass gatherings. In addition to that, people understand what they need to do personally. They need to be washing their hands. They need to be covering their cough. They don't need to go to work if they're ill. And I know that creates issues for individuals who don't have sick leave or who need their paycheck. We're having conversations as well about how we support individuals who may be negatively impacted from an economic perspective, but please don't go to work if you're ill. Please don't send your children to school if they are ill. In addition to that, we are wanting to make sure that people understand that we don't know at this point exactly how long this virus lives on surfaces. So to be on the safe side, washing down those surfaces that have hands on them regularly is a good idea. So, and there's guidance on our website as well as the CDC website about what type of materials to use and how often to do that. So at this time, I'm going to turn it over to Chief Graham. Thank you. I started calling Chief White. That's to talk to us about the emergency operation work in the county.
Good morning. I'm Chief Graham with Charlotte-Mecklenburg Emergency Management. It's a division of the Charlotte Fire Department. So we cover all of Mecklenburg County and the city of Charlotte. Just want to let everybody know that we are fully engaged in our coordination efforts here at the Emergency Operations Center. It was opened yesterday at 1:00 p.m. and will remain open for the duration of this event. Our emergency operations plan has also been activated, along with our joint information system, which is our group of public information officers. They're always coordinating and working together to ensure that one message is coming forward from the city and the county as well. Also, we have a policy group in place, which Chief Johnson is the coordinating entity for the policy group. They work at a more strategic level. The members working in the Emergency Operations Center are constantly working to coordinate and communicate our resources here in Mecklenburg County. We also serve as the point of contact for NORCOM Emergency Management at the state EOC. I want to reiterate that Gibby Harris and the Health Department are the incident commanders for this event and this incident in Mecklenburg County, and we are supporting them wholeheartedly. Thank you. Dean.
Questions?
Do we know if the people who tested positive, have they been traveling? Do we know any of that situation?
Gibby?
So we are investigating that at this point in time. We do believe one was possibly related to some out-of-country travel, and the other may be related to state travel, but we don't have specific information on that at this point in time.
I have a question for the hospital, if that's all right.
Which
Do
one?
you have people representing hospitals here?
We do. We have Atrium and Novant.
Yes, I would love to ask one of them a question.
What's the question?
Well, the question is, in several other countries like Italy, China, South Korea, and Japan, infected people get into panic because they can't breathe. So they come into the emergency room, and they're very contagious because they've been suffering. And essentially, you have a receptionist, you have nurses and doctors, you have other people there for other reasons. And right now, there's no way to separate them and treat them effectively, and at the same time, protect the healthcare workers. The University of Utah's hospital has pressurized tents outside of their ER so that when people come, and they will come, they can come to the tents, and that way we can better protect the healthcare workers. I asked about that yesterday, and I'm wondering how much progress has been made on that.
Dr. Hunter or Dr. Fletcher, is there?
Thank you. I'm Dr. Jim Hunter with Atrium Health. So there are plans in place. We do not have community spread, so you may not be seeing some of the things that are visible in other communities. But there are plans. We certainly take care of infectious patients every single day, and our staff is both trained and ready for this and ready for the more severe pandemic. Working closely with the county and the city, we think that we have everything in place so that we can handle those things, whether it's exactly what you saw on the TV or not. It will vary by site most likely. Turn it over to Dr. Fletcher.
Sure. Good morning. I'm Dr. Sid Fletcher with Novant Health. What I would tell you is that Novant Health is prepared. We do deal with viral infections frequently, including influenza. We are looking at what other measures we can take. We have separated our emergency departments in sick and well areas currently. We are also looking at having alternative testing sites outside of the emergency departments. We don't want the EDs influxed with patients who are just requiring testing, for example. We're also looking at setting up an external tent at Presbyterian Medical Center. Not opening that yet because, as Dr. Hunter alluded to, we're really not in the situation where we will need forward deployment of triage, but we are preparing for that eventuality should it become necessary within the community.
And sir, if I may follow up, obviously, all the science points to mostly mild cases. Would you prefer that people telephone and internet call their provider? And I guess, what is the criteria you want to tell people for showing up at the ER? Because these emergency rooms in Italy, from all reports, are overrun.
Right, so that does bring forward really the central question, which is really who should seek emergency care. So those that are obviously more ill. So what does that constitute? That would be people who are short of breath, things like that. That is one of the things that we're seeing with this illness. Those that are essentially doing well, as you mentioned, many people who will get it will have a more mild type infection. And I think Gibby Harris has alluded to it, is that many of those will be really in quarantine in the home environment, and we'd like to keep them out of coming to the hospital under those circumstances. Jim?
So very good point that you brought up. For essentially every patient but the most severe, we advocate that you either call your physician or call one of the helplines that are set up. There are virtual visits that are available. We've tried to get that out widely so that through the virtual visit you can get a complete assessment to help determine whether you need to come to a physical place or not. And then should you need testing, there will be sites set up remote from the emergency department and others where you can be safely tested without exposing others. So as a default, calling first or using a virtual visit is a very good first step. Of course, if you have more severe symptoms, then you can call the ambulance and let them know in advance that you have symptomatology so they are prepared for you when they get there.
So you would tell 911, I feel like I could possibly be exposed?
I think what you would say is, here are my symptoms, and if they're influenza-like illness, so you have the fever, you have the cough, you have the muscle aches, those sorts of things. Most people won't know if they've been exposed, but they know what their symptoms are. And if it sounds like the flu and feels like the flu, you should identify that to any healthcare provider that you're going to be intersecting with, whether that's your doctor's office, the hospital, the emergency department, or any of our paramedics or mobile medicine.
So I just want to give our medic representative an opportunity to respond to the 911 piece.
Thank you, Dr. Hunter, for that comment about 911 providers in our community. And I want to let you all know that since January of this year, we've been doing expanded screening on 911 calls for all folks who call into our system. And we are asking those questions on the phone. As of this week, we've expanded that screening to all folks that call into our 911 communication center. They go through an emerging infectious disease screening tool. This tool enables us to understand prior to our arrival if we think an individual has a likelihood of having an emerging infection. Based on that information, we then respond with a set protocol for infectious diseases, do a hands-on assessment of the patient, and if we think that the field screen is positive, we immediately call both the public health department and the receiving facility, Atrium or Novant, and inform them of the case that we have.
What is your threshold for
Yeah, sorry, just, this is for Gibby. Do you know when we will know more information about the people who tested positive? Are these presumptive positive that still the CDC needs to verify?
So these are presumptive at this point in time, but because of the testing situation in this country, we are assuming presumptives are positive. There will be a process where they go through and be validated, but right now we're assuming positive. And I will, one point I do want to make, I think, is that these individuals are ill, but they're isolating at home. They're not severely ill. And we need to be supportive as a community of individuals who have been exposed and become ill from this infection. We will provide you with as much information as we can, but I will tell you that will be limited. It may not be as much as you want. And so I just want to be clear that we will not be naming individuals, telling where they work, telling where they live. None of that information will be made available. That's protected health information. So I just want to level set that from the beginning.
Can you clarify, do they both live in the county? And that one doesn't-
We don't believe one of them does. We're, like I said, we got the test results at about 11:30 last night, so staff are in the process of just starting the investigation process, and I heard just a few minutes before this started that one of them likely does not live in the county. They were tested at a facility in the county, but not living here.
Can you tell us male or female?
To be perfectly honest, I don't know. Sometimes it helps not to have the information.
You mentioned that there was an indication that there was both domestic and international travel. What does that mean? Did they fly through Charlotte's airport, and what does that mean as far as changes at the airport or notifying passengers?
Again, we're just starting the investigation, so we don't have specific information on that. If there is a need to contact individuals who had been on a flight, we will do that through CDC. But at this point, we don't have that information. And it appears from what little we do know is that both of these individuals probably were not infectious at the time that they may have potentially been involved in travel. So that's the best we know at this point in time.
Gibby, what's the definition of community spread? Excuse me, sorry, when we talk about that in community transmission, if you have people who are saying, I don't know where I got it, or we're investigating the travel, at what point do we say there's actual spread in the community? Is it 1 case? Is it 10? What's the threshold?
There's really not a threshold. Once we start seeing cases where there's not an obvious contact, not an obvious exposure, then we assume that we've got community spread.
Yes.
You mentioned that we're being selective on who we're testing right now due to the shortage of those tests. Can you make that a little bit more tangible as far as the numbers of tests available or how limited those tests are?
Well, so here's the issue. With testing, there are layers, right? So there's the collection of the specimens, which means you have to have the equipment and the medium to be able to collect it. And we are in the process of making sure that we've got sufficient amounts of that. But then there are limited numbers of places that it can actually implement the tests. And that is the other limiting factor. And the other thing is, for some tests, we want to make sure we get them back as quickly as we can if we think that it's somebody that could be infectious. So there's different things that sort of limit how we're using the testing we have available to us. We are having conversations right now with other community partners, including the hospital systems, Medic, about the potential for some community testing. As soon as we're clear about what our capacity is to do that, we will be getting that information out. But we are working through those issues and making sure that we have the resources we need to do that before we offer it.
Is that more of a local or a national effort, or a combination of the two?
Combination of the two. Combination of the two. We're having local conversations about what our capacity is and what we can do, but that conversation is happening at the state and the national level as well.
One more question about events. You had mentioned that conversations are happening about events. At what point would public health say, listen, you know, we're recommending or requiring that all of the events in Mecklenburg County not go forward to prevent community spread? Is there, like, what does that situation look like?
So at this point in time, we're waiting to hear what the governor has to say this afternoon, because if he makes specific recommendations, we would like to be consistent across the state. And after that, we will have more conversation about any specific recommendations we need to make in the county.
I have a question.
Eric?
Gibby, at what point did you start to, or maybe this is the governor that will do this, at what point do you begin to separate from, say, a ball game or a concert versus a shopping mall, a restaurant, that kind of thing? How detailed do you think this will get, and how soon?
Well, we're watching what's happening in other places where they have ongoing community transmission, and we're seeing a number of different things. I mean, you've got a containment center area in New York, and in San Francisco, they're limiting based on numbers of people convening in one place. So it just really varies across the country. We're looking at that and looking at how successful they are with those sorts of things, and that will help inform what we do here.
I have a question for CMS Schools, Superintendent Winston. My question, sir, is what would be the threshold to close down CMS schools? What is your message to parents? And then, are there any plans in place for children who don't have enough to eat?
Thank you for the questions. We continue to work collaboratively with our partners at the city, county, and the health department on planning and preparing for this pandemic. In terms of our plans at CMS, we've been working for about 3 weeks now to develop a plan, and we are refining our plan day by day. We know this is a rapidly changing situation. We continue to, we have a meeting actually this afternoon to again look at the things that we have in place. My message to families is we want, and it's consistent with the message that Ms. Harris provided earlier, continue to take precautionary steps. If a child or an adult is sick, we strongly encourage them to stay home. We also continue to encourage students and adults to wash their hands and do so more frequently. And so we're also working on the plan to make sure that should we need to, and we certainly have not approached that point, we obviously rely on the feedback and recommendation from our partners at the health department whether schools should close. And so I think Ms. Harris was very clear today. There's no recommendation that schools close, but we continue to work through our plan and refine that plan.
Any other questions? Yes.
What about places where there are, you know, kind of, you can't have social distancing, whether that's our homeless shelters, the jail, things like that, places where people have already probably compromised health situation?
So again, we are working with providers of homeless services to look at options for individuals who may come into those shelters who may be ill, and whether there is opportunity for some isolation or quarantine if needed with that population. We're also looking at what we would need to do in this community if we had individuals who needed to be isolated and were not able to be isolated at home or did not have that as an option. So we're working through all of those things, and are in pretty far along in our planning around those issues, and we'll continue to stay involved with our partners to make sure that we're addressing those appropriately.
I will tell you that I've had a few conversations with Sheriff McFadden, and he is working with the healthcare provider in the detention center to make sure that they are doing the appropriate screening when people come into the jail, when they're arrested and come into the jail.
Does Brett Cable have a time for a question?
What's your question?
The airport, what's your message about people who are thinking about flying or
Yes.
maybe trying to fly to the UK?
Brett? Brett?
Good morning. I'm Brent Cagle, Aviation Director at Charlotte Douglas International Airport. For people considering travel, I would, as others have reiterated here, you need to make the choice for yourself and watch the recommendations from local, state, and federal health agencies. Clearly, that is, they have the most up-to-date information and can provide potential passengers really the best information to help them make their decision on whether or not they should or shouldn't travel.
Mr. Cagle, what is your recommendation to employees at the airports who are there? I heard anecdotally, I was there yesterday, from employees saying they've been told they can't wear gloves, they can't take protective measures, because it's not a good look to the public. Is that actually the message that's being sent out right now? What are employees at the airports doing for their own safety?
Yes, so that is not the message that personally the aviation department or myself and my leadership team has put out. We are looking at PPE or protective equipment that what needs to be issued to employees. We are also working with our partners. You know, airports are really a large collaborative effort. We have the TSA, the FAA, we have concessionaires and airlines. So we're also in frequent contact with our partners to really determine what are the measures that are appropriate, reasonable, and rational for our employees to take. Certainly, it is not our concern about a good look, so to speak. It's our concern to make sure our employees and our passengers are safe, you know, and are taking appropriate precautions.
Is it fair to say you found out about the ban when we did it?
The travel ban for Europe? Yeah, I found out last night watching it on TV.
Okay, we have one more question.
You recommended that folks older than 65 avoid large gatherings. Does this include, even if they do not have, compromised immune systems or other underlying health conditions?
Anyone over the age of 65 is considered high risk for negative results from a COVID infection. So yes, we're recommending that anyone who is 65 and older, regardless of whether they have compromised immune systems or underlying conditions, think seriously about their exposure in the community. And unfortunately, that probably includes travel at this point in time.
So we want to thank you for being here this morning. We will continue to call the media availability. If we need to do it every day, we will. We will make sure that we keep you and the community informed about the situation on the ground here in Mecklenburg County. And so we thank you for being here today, and we will, again, keep you informed. Thank you.